So good morning, everyone, and welcome to the Collaborative on Health and the Environment Alaska Teleconference on Science and Action to Protect Public Health, How Healthcare Professionals Are Changing Chemicals Policy, with guest presenter Martha Arguello. My name is Diana DeFazio, and on behalf of Alaska Community Action on Toxics, I'll be facilitating today's call. CHE Alaska is a regional partnership group of the National Collaborative on Health and the Environment. CHE Alaska aims to advance knowledge and effective action to address growing concerns about the links between human health and environmental factors. You can find more information on the websites www.healthandenvironment.org and www.akaction.org. The call will last 1 hour. Except for the speakers, all participants are muted during the presentation. There will be time for questions towards the end of the call. And now it is my pleasure to welcome and introduce Martha Arguello. For the past 32 years, Martha has served in the nonprofit sector as an advocate, community organizer, and coalition builder. She joined Physicians for Social Responsibility Los Angeles, or PSR-LA, in 1998 to launch the environmental health programs and became executive director in November 2007. While working as a health educator in the 1990s, Martha had an epiphany. She realized that although early detection can prevent death from breast cancer, it does not prevent breast cancer, which has been increasingly linked to exposure to environmental toxicants. Since that realization, Martha has dedicated her career to the environmental justice movement and has lectured nationwide on the use of precautionary principle policies. We're very honored to have you, Martha. Would you like to begin?
Yes, thank you, and I really want to thank my hosts here in Alaska. It's been pretty wonderful, and they've managed to take my sun-loving tropical self and not too much of a weather shock. So I'm very happy to be here. They've been wonderful hosts. And I'm incredibly excited to be on the call with you all. So I'll start by just giving you a little introduction about PSR, particularly Los Angeles, and there's a national network of chapters throughout the country, and there's members all over the country. And so PSR Los Angeles is among the largest chapters in the country, with about 4,000 members, of which about half of them are physicians. And so we have physicians, PhDs, nurses, podiatrists, homeopathic medical providers. So we have a range of healthcare professionals, and we also have strong student chapters in Los Angeles with USC and UCLA medical students there. And as we started as an organization nationally about 40 years ago, maybe 50 now, really looking from physicians, looking at the frame of first do no harm, and recognizing that at that time one of the gravest threats to public health was from nuclear weapons. And that is what the passion that brought many of our physicians out of the clinical setting and into the advocacy world. And as I got to know more about the organization, I also realized that those same physicians who started PSR were also pioneers in the social medicine field. And so they were first to understand the social determinants of health and the relationship between economics and race and health. And so they had these multiple hats they wore at PSR. They were passionate about their work they did against banning nuclear testing and nuclear proliferation. And as the organization grew, they also began to recognize that there were also other large-scale threats to human health and the environment. And so in the 80s, PSR Los Angeles was one of the first chapters in the country to begin addressing issues related to global warming. It was a group of residents at UC Davis in UCLA UC Davis in Irvine, that began to take on the issue of gun violence as a public health issue. And so residents, which is rare for residents to be that active, but we had this core of these 3 residents who decided to participate in the lawsuit against the Saturday night specials that were handguns. And at that time in California, we had an epidemic of gun violence in urban areas. And so that tradition is kept alive by our physicians. PSR-LA has a board of about 10 physicians. All, again, when you look at their biographies, they're deeply rooted in social justice. And so when I came to the organization, we were really looking at the issue of pesticides in the state of California. and that in order to win, we needed to reframe the issue of pesticides as a health issue. And until then, it had been seen as primarily an environmental issue, not a public health issue. So my first task was to, and I had done a lot of training and work with physicians in my work both in AIDS and in breast cancer early detection. And so I'd had, it was fairly relatively easy to recruit and train physicians for those issues. So I ran into quite a brick wall when I came and started my job trying to train physicians to get them to speak to the media on issues related to pesticides. And I'll talk a little bit about why that was a little bit later in the talk, but over the years we developed these strong environmental health programs and began to look at the issue of toxic chemicals. And many of our chapters are working on these issues together. And in one of the projects that we did, where we really tried to address both the issues that physicians face, nurses face in their workplaces, but also something that would be able to be used as a policy education tool. So our national, collaborating with several of the chapters, published a report, Hazardous Chemicals in Healthcare, and it details chemicals found in the bodies of healthcare professionals. So for many years, Physicians for Social Responsibility had worked with Healthcare Without Harm to reduce the footprint of healthcare on the environment, and had great success with reducing mercury and eliminating mercury in hospitals. And we did a project where it was a great recruitment tool for physicians. We replaced old mercury equipment in 25 community clinics in Los Angeles, because we knew hospitals were going mercury-free, but community clinics that are safety net providers that are in low-income communities, often serving environmental justice communities without having a strong background in environmental health in their clinics, we thought our strategy would be to develop a partnership with those clinics, both because we wanted to educate them, but we also really wanted to recruit them, because they're actually seeing the patients that live near the refineries, live near the freeways. They were on the front lines of the asthma epidemic in Los Angeles because of air quality issues. And so that program we called our calling card program, and it allowed us to develop great relationships with physicians and as many organizations. This was already sort of around the year 2000. We realized that our organization, when we had events, was an aging population. Our members had been with us for 30 years. And it's wonderful. Some were, remember starting with the organization when they were in medical school, and now they were mid-range and some even getting ready to retire. So we realized that to have a vibrant organization and to be able to bring important voices of the healthcare professionals, we had to train and recruit the next generation of physician leaders. So out of that was born our Physician Ambassador Program, which is we have quarterly trainings. We spent a lot of time talking to individual physicians, trying to understand what were the challenges for physicians to get engaged in policy efforts. And while we were doing this, we were also very, very much engaged in statewide and national chemical policy reform. So we were always finding ways to engage as we met, and we thought, they're ready to do a small action. So we called it high impact, low time commitment activities, such as letters and op-eds, radio interviews, and we were sort of looking for that physician, those physicians that could really be good at the policy work and had a passion for it. So the ambassador training focuses primarily on giving them the science resource and tools and the studies and the research and the bibliographies so that they could study on the issue at their leisure. The issue that most worried them, and we were sort of surprised by this, was that they did not feel comfortable talking to the media. They did not feel comfortable, as many advocates do, reading a report and then doing press work on that report, all within 2 weeks. They felt that if they got asked a question by a reporter, they had to answer it correctly. And sometimes reporters would be asking clinical type of questions that are, when you're dealing with environmental health, is very difficult to answer. I can't tell you that exposure at that time gave you this illness. And so the physicians told us, well, I'm just nervous about that. That's not how I practice. That's not what I do in my everyday practice. So we designed the second part of the training to really be a very much hands-on, how to talk to the media, how to handle reporter questions, how to answer legislator questions, and how to talk to legislators. And we brought in a company that we'd worked with that's one of the best companies we'd ever worked with, and so the training that we did really helped those physicians get comfortable speaking, because they often get very nervous. So they're okay in a clinical setting, but in other settings it's not as comfortable for them. So we found ways to make them very comfortable, and we backed them up with the science and the research. But to get to that point where we had the ambassador training, it took several years of organizing, of trying things that didn't always work. But that ambassador program really has helped us in amazing ways. So we've trained about 60 ambassadors. I would say about 10 of them are active. And so they attend lobby days, they do visits. A couple have done news segments around finding access to safe cosmetics and safe toys. All have been, and all of them in coordination with national efforts. So we had a lot of what we do in LA is we handle it's a large media market, a large Spanish language media market, and so we get a lot of calls for those kinds of interviews. And there was a time when we couldn't just pick up the phone and call a doctor. We'd had, it was just, it took us a week to find someone. Now we've gotten to where we have this cadre of our ambassadors that are much more ready to deploy. And this year we finally got funding specifically for that program, and we will be doing 4 trainings throughout the year on the key issue areas that we're working on. And so that every training has the science part and the article, all the lists of articles that are related to, let's say we're working on TSCA reform. So we'll have a lot of the data for them to look at in terms of chemical exposure and health impacts, but the major part is really that practice and watching themselves on camera so that they can see what they look like, so that if they're too stiff, if they're moving around too much, if they're stuttering, and we give them very specific coaching tools for getting beyond some of the nervousness, and it's been incredibly effective. And we constantly learn, because there is an expectation that doctors are expert on everything. So we get calls, oh, will one of your doctors be on one of our committees? And it's learning how to be on a stakeholder committee is not always easy. And so we've had a few incidents where doctors are like, oh, you really shouldn't worry about that, and we're a little bit cringing, but the impulse of a doctor is to not worry people, because a lot of times when we're talking about chemical exposures or radiation exposures, you have to be really careful when you're training a physician to understand those nuances of what you might tell a patient is very different from what you might want to tell a policymaker. And we're not saying don't tell the truth, but how you frame that message for a policymaker is got to be in terms of prevention and moving upstream. So that's been a big part of what we do trainings. When we did the national report, again we had, and I'll tell you a couple of stories of how the physicians have been able to become engaged. So 2 of the physicians that we trained are LA based, and there were physicians from a number of other states that were part of the report. You can get the full report. It was 10 states: Alaska, California, Connecticut, Maine, Massachusetts, Michigan, Minnesota, New York, Oregon, and Washington. And they all agreed to be tested, and they found about 62 different chemicals in all: bisphenol A, mercury, fluorinated compounds, phthalates, polybrominated diphenyl ethers, PBDEs, and triclosan were the ones we tested for, and we found them in most cases. And one of the big challenges is that doctors are human, and so the knowledge of having these chemicals in their body really did have an impact in terms of how they looked at the policy. It gave it a sense of immediacy. One of our doctors was actually a breast cancer survivor and has now really become engaged more professionally in the area of environmental health. And she's been a great ally. And for all of us who run nonprofits, the added benefit of having the ambassador program is that almost all of the ambassadors who came to the trainings have now become active members, but they're paying their membership dues and they're donating money. So we have found that ambassador program not only helps us on the policy front, but it helps us in terms of our own organizational development. And we're very happy to see that many of these physicians are in their 30s and 40s, which means we are training that next generation of physicians. And one of the ambassadors has now taken on the task of being a student sponsor of one of the student chapters, which has made that student chapter even stronger. So all of this to say is that there are great benefits to working and organizing with physicians, both in terms of policy, but in terms of helping your organization develop some sustainability. The ways that we've done in Los Angeles, in Southern California, PSR is sort of an anchor group in Southern California around issues of environmental health. In the state of California, our sister chapter in San Francisco has done and pioneered some amazing work in organizing with physicians in his past, and I think this is a great strategy. You have to plan for it at least 2 years in advance because it takes time to move these, but there are resolutions through the medical societies. So we have resolutions around nuclear weapons, about sustainable energy, about pesticides in schools. Every major policy campaign that we've had, Dr. Bob Gould in San Francisco has really been the leader in this, in getting these resolutions passed with the California Medical Association. And the California Medical Association is an extremely conservative group. Their primary concern has been medical billing, and so they don't have active lobbyists on the environmental issues. But once you pass a resolution, then it becomes policy of the CMA, and it's a great thing to deliver to legislators when you say that you have a bill you've introduced that has the backing of the State Medical Association. And so that's been very successful and useful with our Healthy Schools campaign. That was the one time they actually walked the halls with us, but that took 3 years of work. And that was the third year we introduced the bill when they finally actually came out and lent us their offices for meetings, and they did legislative visits. So again, it's labor intensive, as all organizing is, but it's a great payoff. We always talk about policy wins being made. You can make the policy win when you walk in with a coalition of unusual suspects. And so for our Healthy Schools bill, we had a coalition of physicians, educators, parents, environmental justice advocates, and so within 3 years of that organizing project, when we introduced the next Healthy Schools bill, it was no longer seen as an environmental bill, it was seen as a health bill. So we were able within 3 years to really reframe this issue from an environmental one to a public health one. Another campaign where our physicians were incredibly important was on our bill for bisphenol A. So that, again, was a 4-year battle of introducing the bill every year and it becoming a 2-year bill. And what we realized in California, you have this sort of north-south divide. And the south part of California is a lot more diverse ethnically, and the members of the Assembly and the Senate from those areas are also more diverse. So a lot more Latinos, but a lot more Latinos that are elected tend to behave, we call them the mod squad, the moderate Democrats, but they tend to vote like Republicans, and they tend to be hostile toward environmentalists, because in Southern California there's a divide between the east side and the west side. Sounds like gangs, but they're electeds. So we developed a strategy where we thought the most important voice on the bisphenol A campaign should be the voice of women of color. So but we also had a strong voice of physicians. We had the American College of Obstetrics and Gynecology was working with us. The American Academy of Pediatrics was very supportive. So and the American Academy of Pediatrics tends to be the most progressive and a great target to develop relationships with. And again, those relationships take time, but because we had done so much work around bringing healthcare voices on other issues around pesticides, when we did the bisphenol A bill, it was a lot easier. So we had about 150 physicians that signed letters to the Assembly and to the Senate on bisphenol A. We had a specific outreach. We did a specific campaign of Latino physicians targeting those Latino electeds. And because we used some prominent Latino physicians, they actually had relationships with those elected officials. So we did a letter specifically. There's 5 very well-known Latino physicians in LA County they do a lot of training of other residents and are also engaged in a lot of policy work. So they spearheaded that campaign, and we know that it was effective because we sort of heard from legislators, like a number of legislators said, you guys are just doing an amazing organizing job. I get more calls from a very wide range of people on bisphenol A. In fact, some of them were upset that we were actually organizing their constituents because they couldn't hide that they were not supporting the bisphenol A bill anymore. And we did a number of things. So we worked, the health care professionals were really critical, and on bisphenol A, we had one physician legislator who tended to be very conservative, very much he felt that and he was very angry with CMA for passing a resolution on bisphenol A, and he felt that the science wasn't there, and he got very upset with the advocates who, he yelled at them saying, you guys aren't scientists, I'm a scientist, and you don't know what you're talking about. So what we decided to do is actually look for academic physicians who are physicians, but PhDs, and are in major universities, of which we have several, that could target him and go talk to him. And in that process, we actually found physicians who'd given him money. So again, because we had this large network of physicians, and we'd say, do you know Assemblymember Pan? And they're like, yeah, I know him. I gave him money. My husband gives him money. Can you call him? I'll call him. So we did scripts for them, and they called him, and we actually had Tracy Woodruff from UCSF also sit down and talk with him for an hour about weight of evidence and what that means, and how to understand the conflicting, the seemingly conflicting science around bisphenol A. And he came around very much, and so we were very worried because, again, he as a physician speaking on the floor against this bill was not good. So we managed to take care of that by, again, our broad-based coalition, going through our networks and figuring out what physicians we could use. We had a former State of California health officer calling. Again, he's one of our trainers for our ambassadors. So this network of relationships is incredibly important for any kind of mobilization of healthcare professionals. And the other thing we did is we have been doing a lot of work around this intersection of women's health and the environment for many years, and it has really grown and really strengthened. And so we work a lot with reproductive justice and environmental justice groups coming together to look at the specific way that environmental toxins at the community level or consumer level impact reproductive and developmental health. So we had a number of reproductive justice groups who had amazingly good relationships with many of these same legislators. And when I went with the Reproductive Justice Coalition to lobby, they welcomed us into their offices. They were very nice to us. But when we called as Physicians for Social Responsibility about bisphenol A, they didn't want to talk to us. And they didn't want to talk to the women that we worked with who were constituents, were donors. We know them for long times. They sit on boards of organizations that we work with. And so we really had a lot of work to do to figure out what's the problem, why is there such hostility to the environmental health issues, and how do we get past that. So we really sat down and said, we talked to about 4 or 5 of the legislators. We started to understand what the issues were. And so when we talked to them about bisphenol A, we actually focused less on the science and more on the fact that in Southern California, if you live on the west side of town, you actually have stores in your neighborhood, including 99-cent stores, that sell BPA-free bottles. But if you live in the east side or the south side, you're not going to find them at the 99-cent store. You're not going to find them at the corner store, and the big box stores don't exist there, and people aren't shopping for them there. So we started talking about we needed regulation that wasn't voluntary, that didn't create a dual market, that discriminated against low-income women and women who didn't have access to information. And we had physicians deliver that message. And it was great because we had physicians from community clinics writing letters saying, in the clinic I work in, we do not have access to BPA-free bottles. And so we knew that it worked because we did a number of other things. We also began to go to all events sponsored by the Black Caucus and bring a cadre of women. And we brought, one of our OBGYN allies would come, or our reproductive justice allies would come, and I would come, and we would all go up to them and ask them, why did you vote no on BPA? Why did you vote no on the flame retardants bill? And they would be stunned. There's like 14 women at their events that they know and have personal relationships with, because we chose sort of elders within those communities. And I don't mean just elders in age, but sort of people who've been in the movement for a while, to ask them these questions, and so they couldn't dodge them. And there was one who was just very recalcitrant, and we got his vote. It was amazing. We met with him. I met with him individually and with Dr. Karp. I don't know if folks know who Harvey Karp is. He's a pediatrician who wrote Happiest Baby on the Block and Happiest Toddler on the Block, has done amazing work around environmental issues. So he and I had an hour meeting with him, and he finally said, "I'm good. I've got your, you moved me. You've got my vote." And we got his vote, and people were stunned because a lot of folks had written his vote off because he was so hostile. And again, it was this great partnership between physicians and women's health advocates working together. And so once the bill passed, I mean, we did all kinds of funny things on this bill. One of the votes came around St. Valentine's Day, and we did those little heart candies that said, "Be my Valentine." So we sent them to staffers who are our friends in legislative offices, saying, "Be my," because they kept telling us, if you get to 21, I'll be your 21st. I'll be your 22nd. So we said, "Be my 21st, be my 22nd, be my 23rd," and the staffers really liked it. And so we had, interestingly enough, we had a lot of staffers who were really supportive. And in California, because of term limits, staff opinions become incredibly important, because there's such a high turnover in terms of legislators. They're there for 2 4-year terms, and then they're gone. And so staff and working with staff becomes incredibly important. And we were always accessible to them. We were always sending them information and reports. And that really made a difference this last year, and the bill passed. And then that same network of healthcare professionals and women then targeted the governor. And I know that we had a couple events where we had people pulling out their cell phones to make those calls, and both physicians and constituents and others calling the governor's office, and he signed the bill. And we were very nervous because he had already sent out messages that there was going to be a lot of unhappy people. He wasn't going to sign all the bills, but he did. So again, that was an amazing partnership. Okay, so let me sort of tell you a little more about what we think works. So the resolutions, I think if you're working at a state, figuring out, finding that one or two, it only takes one or two progressive physicians that's willing to, that are members of the medical associations, who are willing to go. It's not, it's not everyone's cup of tea going to some of those meetings, but so finding that person, using some of the tools that we've already developed that will, and all of these resolutions are available online. Most of the resolutions, because they were passed through the San Francisco chapter of Physicians for Social Responsibility, you can find them on their website, so you can get a sense of the language of how to craft them. Think you should start thinking, and then the other part of the research that's really critical is, when do they meet? When are their newsletters? Who are their lobbyists? And then what's their process for passing resolutions? Some are they're very mechanized. You can go online and write a resolution. You can go online and research what other resolutions they've passed. And that's, it's a great tool for organizing. And the other reason it's an important tool is that for a lot of physicians, it's important to keep in mind they get 6 hours of training in environmental health for the most part. And so they often don't understand the relationship between exposure and illness, and will often discount exposure as related to illness. And so that's a big part of the education. And I know certainly with our own organization, it took some time to presenting information so that they understand that it isn't about a smoking gun, but it is about understanding weight of evidence. And a lot of the tools that Healthcare Without Harm, Generations at Risk, In Harm's Way, and these are all reports that are available for download, were developed to educate physicians. And then now there's, many physicians are actually incorporating this into their practice. So I'll talk to you about another success story that we had in Los Angeles. We spent a lot of time working with one particular clinic, the St. John's World Child Clinic, and they develop a social medicine department. which was amazing, and we did a lot of work with them around the issue of pesticides. We also organized a baby bottle exchange, a BPA-free baby bottle exchange in their clinics. So we really targeted services that the clinic couldn't provide. So when they need a health educator to come out and do a training on integrated pest management, we go there. When they need us to do a safe cleaning products training, we'll go to the clinic and train their health promoters, who then in turn can train their patients. So we invested a lot of time and energy in that particular clinic, but the payoffs have been wonderful. One, they have a social medicine department. They are now going to electronic medical records, and this is just so exciting for us, is that they now have so basically you go into the clinic, they're doing either well child visits or whatever the visit is, they open up the computer and they go through the questionnaire, the things that they have to check off, so lead test or whatever else it is. They've now put in an environmental health screen question, and we helped develop that. Actually, Ted Scheffler from Science and Environmental Health Network sent me some resources. We helped them develop that. And so now they have a set of triggers to know when to do a deeper environmental health investigation. And why it's been very useful to us is that we have a strong pesticide program where we're trying to make sure that people who are overly exposed in urban areas are actually sometimes poisoned but not being diagnosed. So we work with the clinic to say if a child comes in with a roach in their ear, you need to do an environmental health assessment. And what we were stunned to hear this, but there is one of the reasons the clinic developed this program is that they knew that they were seeing patients who were living in homes that were creating health problems. So either kids were dealing with mold, asthma, allergies, and what we found is they were living in substandard housing, and some of it really bad housing. And so we knew that if there was a roach in a child's ear, that merited a home visit by the health promoter to do an assessment. So we've currently trained about 200 of the promotoras to be able to do a walkthrough and to survey the residents and if there is signs of overuse of pesticides, then they get referred to the clinic. And we're hoping that this will, it's still a pilot, we're still sort of figuring out how this is going to work, but what we're hoping is that we'll be able to get official doctor reports of a pesticide illness. Because that is a huge policy lever to force the city of Los Angeles to develop different sets of code enforcement for housing. And our goal is that we want to use this environmental health education to change code enforcement, to improve code enforcement so that they're actually fixing the repairs in the substandard housing. Because it's that substandard housing, it's the leaky faucets, it's the peeling paint, it's mold, it's all of these things that are actually creating lead-poisoned children, overuse of pesticides, and mold-related illnesses, which are asthma, allergies, and other things. And so we, over the next few months, we'll be reviewing the questionnaires and shoring up the training for the promotora so that they know how to do a walkthrough, how to do a trapping to assess the level of infestation, and then how to actually use the IPM products. And so we just wrapping up a 2-year pilot where we've gone into privately owned substandard housing, and we worked in a 40-unit building, a 10-unit building, and a 15-unit building to pilot the IPM intervention over a year. And we found, well, IPM works. The residents actually report feeling better, and it's combined with a green cleaning process. So we do the green cleaning and the integrated pest management. We show them how to make their own products, but also how to trap. And the big piece of that that's made this effective is that we actually train building maintenance staff on how to do IPM repairs. So that's been very effective in deepening our relationship with that one particular clinic that has about 6 different sites. So it's one of the larger community clinics, and it works throughout South and Central Los Angeles. It took us about 2 years of working with the community promotoras in the clinic to actually develop the kind of relationships with the physicians that we needed. So a number of their physicians have been the ones who come and testify. We've had the chief medical officer of the clinic at a number of legislative meetings, and she's a really dynamic speaker, so we have her at press conferences. And again, we wouldn't have been able to do that without that initial relationship building program, starting with Healthcare Without Harm around eliminating mercury equipment. So people saw us as a resource, not as, oh my God, here they come, they're going to ask me for something. And you have to take that into consideration when you're working with any healthcare professional. You have to find what your added value is, what you bring to them that they don't have, and how are you going to make their lives easier. Because if Alaska is anything like California, we have a huge problem of the uninsured, and so those safety net providers are incredibly busy. And so but it was definitely worth the investment because they've become really critical partners. So, for example, one of the things that they've helped us do, we're doing a big event on Thursday around neurodevelopmental disease, co-sponsored with the universities there. And through our work with that clinic, we've actually identified a number of patients who have children with developmental disease who have also started to become activists and are going to be speaking at the event and giving a parent's perspective on neurodevelopmental disease. So again, the value comes with the clinics. You have a built-in health education component that if you train them, they have a great multiplier effect because they're able to train others. And so the tools that we developed, and this year we're actually going to really finally get to the point where we package them as a tool that other people can use. So they're PowerPoints, and fact sheets, and recipes, and we want to put them all in a package and put them online for folks to use this year, because we tend to act like organizers, not as we're not, one of our strong points is not developing publications. We've realized that at PSR-LA that's just not our strong suit. So we've actually now partnered with our national and said, we have all these PowerPoints. They're like one step away from being really fabulous. Can you take them and make them, give them that sort of polish that then we would feel comfortable lending them to other people. So that's what we're doing this year. And we're very excited about this partnership with our national now. Our national, if you go to their website, they have amazing tools. They have a great blog that's mostly healthcare professionals talking about key issues in environmental health. I think Pam, you've also, Pam from Alaska Toxic has also done a couple of their articles, as have I. And all this to say, it's like any organizing. It takes a lot of time. I worked with a group of farm worker women, and the leader said, it takes me 5 years of investment to form a woman leader that's come from the field to be able to work. And I said, it's what it takes to get one doctor. That relationship building, and you would, it's a different kind of work, but it really, again, it's time, it's calling, relationship building, calling to offer things way before you actually need something from them, so that when you have to make that call because you've got a press conference tomorrow and it's Tuesday night, you have a relationship with that. It could withstand that phone call and saying, I know this is short notice, I know you don't like this, but we really need you. And they come through. In fact, I have 3 emails from a doctor from last week who just was in India and is apologizing profusely that he can't do the event. I'm like, it's okay, you're in India. So, but we weren't, that when I first started at PSR, we didn't have that. We spent a lot of time developing our relationships with community organizations and trust with organizations and building networks, strong networks and coalitions. And so we were like a 3-legged stool. We had amazing relationships with legislators. We had great relationships with community organizations, but we hadn't invested in building up our own membership. And that's the lesson we learned from environmental justice groups. Invest in your members, develop their leadership, build their capacity, and turn them out. And we said, we're going to take that approach with our own doctors, and it has been working. So we're incredibly excited about these partnerships. This year we're doing probably a bill around flame retardants. We're not sure exactly what that bill is going to look like. And so we're very interested in helping create partnerships both with our reproductive health and justice allies, but also with physicians in other states, because it is California that drives the use of flame retardants for our flammability standards. So I apologize to everyone for that. And we've been working really hard to change that, and I think this year we have a really good chance. And mostly because of our ability to engage physicians, our ability to engage physicians of color has been critically important. In California, we talk about the new majority, and that is, when you count African Americans, Latinos, and Asians, we are the new majority in Southern California. Well, we are the majority in Southern California, emerging majority throughout the rest of the state. And so it's incredibly important that legislators see that as an organization, we understand that diversity, and we respect it, and we're nurturing leadership. So we've actually had legislators tell us that. Like, we're really, if you come to me, I'll talk to you. But, so we're still trying to sort of get past that hostility to the environmental community. And we've done that in a number of ways by, talking about the investment that our partners have made in us. And that's through funding. A lot of our funding comes through coalitions. And so that's also really critically important to make sure that people know that people are also, a lot of organizations are investing in bringing these new voices to the environmental movement, both the voice of women, the voice of people of color, physicians of color, and environmental justice communities. And those are the kind of the winning combinations. And so this year, our Chemicals Policy Coalition is strong in healthcare professionals and environmental justice groups and environmental health groups. And the name of our coalition is Californians for a Healthy and Green Economy. Our focus this year is really around the economy, because we know that unless we address that issue, it's the thing that will sink any efforts we have. So our organization did a white paper called Public Health and Green Jobs, and talking about the public health benefits of a greener economy. And again, it wasn't something that I would have thought, or folks think of as a healthcare group doing, but we knew we needed to make public health arguments that would trump the "you're killing jobs" arguments. And that's taking great shape. And we're actually partnering with some green businesses, with wet cleaners and others, to really deliver the message that greening manufacturing can actually improve the health of workers and the folks who own them. So on the wet cleaning, we actually had a big conference. We brought about 200 high school students from medical school magnets who are wanting careers in healthcare to listen to John Warner, who is one of the fathers of green chemistry. And it was really wonderful, and how exciting those students were, mostly African American and Latino students. But we also brought folks who are doing wet cleaning, and there's a green urban manufacturing initiative in Southern California. We brought those folks together to really brainstorm of how we create better relationships with each other. And one of the things that came out, and we found this great woman who owns a wet cleaning company, and she basically convinced her husband to switch from dry cleaning to wet cleaning. And he resisted her, but she was persistent. They did it. They now have a number of wet cleaning facilities. And the thing she said, we all stopped having headaches. And that's when my husband realized that this was the thing to do. And he now goes out and talks to a lot of other Korean dry cleaning owners, because in Southern California, about 90% of the dry cleaning facilities are Korean owned, and about 85% of the workers are Latino. So that was a very important move that we made. And we also, those relationships were developed as part of a policy campaign to ban perchloroethylene. And we, again, our partners in the community clinics were incredibly important, because the chemical industry organized the Dry Cleaning Association. And so when you went to the board meetings around the banning of perchloroethylene, all you heard was Korean owners saying, these enviros, they don't care about our jobs, they don't care about us, they just care about themselves, it's going to destroy the industry. And so we were able to offset that by actually bringing, and they took a great risk. So I had friends who worked in several Korean community clinics that served the Korean community, and they came out and they took great risks, because they have great relationships with the Korean dry cleaning owners. Many of them are donors to the clinics. But despite that, came and said, we are deeply concerned with the health impacts of perchloroethylene on workers and the owners. They're mostly mom and pop stores. And they came to only one hearing, but that one hearing was so critical, because as the chemical industry tried to frame this as these white enviros don't care about small businesses and these small mom and pop, these Korean immigrants who've been able to, make a living in the U.S. with this business, and here are these enviros trying to destroy their jobs. We were able to open up another set of dialogue and talk about the health and safety of workers, as well as that our deep concern was the health and safety of the owners. And we had a couple of owners who'd converted to wet cleaning. And so we were able to pass that ban on perchloroethylene, as well as a fee for perchloroethylene that's produced in the state of California, that those fees get collected and get put back out to help dry cleaners convert to wet cleaning. In the process, there's been other technologies that have arisen, and this has, been a challenge. And so wet cleaning is, there's a lot of work that needs to happen to promote the wet cleaning because it is the safest alternative. And again, that voice, one hearing, 5 minutes of testimony made all the difference in us being able to ban perchloroethylene in Southern California. And I didn't think so. I thought, well, it's what you do every day. But the advocates came back and said that meeting, if you hadn't done that, we wouldn't have gotten that. I'm like, well, okay, I'll take that victory. And so, again, it's worth the investment. And I know, and finding ways to do that, and we're happy to help you. Anyone on the phone who go to our website has a lot of our tools. National website has a lot of tools. And finally, I want to talk about some of the fun things that we have done with our physicians and who've actually really liked some of the tools. And so I'm going to talk a little bit about the toxies. So I'm sure we were in our strategic planning retreat several years ago, and we were talking about our chemical policy in California, and we were using the term, we've got to get rid of these bad actor chemicals. And we started sort of joking around, a number of us saying, wouldn't it be great if we did these fact sheets on these chemicals, and we did them like 8x10 glossies, and we said, California doesn't need any more bad actors, because this was, Schwarzenegger was in office, and we had a tradition in California of electing really bad actors to governors in Reagan and in Schwarzenegger, and we just were joking, right? It was sort of a lunchtime joke. And we said, yeah, we could call it, like the Oscars for bad actor chemicals, and so that's how the toxies were born. So the idea, and we thought our doctors are going to get upset with us because this is kind of fun, it's popular education, but we actually recruited 3 physicians who came to the toxies last year, and all of them have now become active. All of them have, and they were kind of amazing because one was a toxicologist, which was great to have a toxicologist who is willing, I want to come to your office, I want to help you. 2 of the other physicians have also gone on to help us on media work. And we did not expect the toxies. We were a little nervous, I have to say it, because I thought, we run the risk of being unscientific because it was really fun. We had actors personify the chemicals. So we had lead, and we gave them these awards, Lifetime Achievement in Harm. So lead was like a aging, heavy, kind of meatloaf-looking guy, heavy metal guy with leather jacket. And mercury is absolutely insane. The actor really understood that the impacts of mercury, and he's done some PSAs for us. So we're on the mercury rule. He did a insane little PSA that we showed. We had a methyl iodide huge campaign in California to try to keep it out of the state, and we had Governor's Call-In Day. So the actor who played methyl iodide did a don't call the governor today, and just hope, so they've had a real life beyond sort of that one red carpet event. And a lot of the doctors said, oh, these are great patient education tools. So we have a bingo game that we developed as part of that, so community organizations can use it as part of their training. And so again, you shouldn't be afraid to try different things with physicians. And and I'll wrap up my talk so we can go to questions. When you're dealing with younger physicians, we interviewed medical students and interns, and they said, we'll do online advocacy, anything